And welcome to today's People to People. I'm Jewel Hillary, and for Micah Mater. Ebola is back in the news following a week of headlines about Hanta virus. Should we be worried? The doctors are in and ready to answer that question. Dr. Ngozi Ezike, and CEO and president of Sinai Chicago, and author, founder of Sterling Initiatives, Dr. Jeffrey Sterling, join us this morning. Doctors, it is a pleasure to have you here. Thank you, thank you, thank you.
Thank you for having us.
All right, so a lot going on in the world of health news. Hanta virus has definitely been in the headlines for several weeks now. What's the update? What can you tell us about it? Is it going to make it here to Illinois, do you think, from the cruise ship, that initial issue about a month ago?
Well, I think that the short answer is it should not. The way things are going in terms of the reduction of the surveillance capacities of the U.S., you never can tell. But, the long and short of it is that there are some important considerations to know. This isn't your last year's hantavirus. We tend to talk about rodent transmission. This really didn't seem to be the case. There's a different strain that's going on here that involves person-to-person transmission. So, the overarching consideration that I would have people think about is that as the CDC kind of pulls back from the diligence with which it has been known for, these types of things are going to keep popping up in weird and newly distinct ways, and we should be concerned about that. But for right now, in terms of that particular disease, give yourself some time. Don't necessarily take that cruise today. Okay. And see where things go. Okay.
Would you recommend people masking again? I mean, because you mentioned this is a different strain of it.
Well, specifically what we're seeing is that it's very close contacts that end up getting this. So the people most at risk are intimate contacts, family members, and healthcare workers. Okay. If you're not in one of those risk groups, you're not likely to get it, but it's always a good idea to protect yourself if you're in a vulnerable situation.
Okay. So, did you want to add something?
Yeah, no, I mean, and this, this cruise ship in particular, there were only a few people. I know everyone wants to make all the, similarities to COVID, but this is a very different virus. This cruise ship only had about 147 people, including the crew, and I think we've only had maybe 10 people that were diagnosed. So hopefully, because of the surveillance that is happening, it will be contained. So I don't think this is the time for people to be alarmed and think that they're acutely at risk, but we always have to pay attention, and we do want our federal agencies to be involved and to be plugged in, and so hopefully we can see how that will evolve.
All right, yeah. Better to play it safe than sorry, right?
Indeed.
All right, so from Hanta virus to Ebola in Uganda and Congo, extremely transmissible and fatal disease. What do people here in the U.S. need to know about this?
Yeah, unfortunately, the DRC, the Democratic Republic of Congo, has had over a dozen, maybe 17 of these outbreaks in just the last 50 years. So it's been something that's happened. And whenever we hear about it, it's probably been going on for quite a bit longer. And this is a disease that we know is very serious. The fatality rate is quite high. And so it's a concern because, as we have learned, viruses can get on planes and cruise ships and travel very easily. So again, this is another situation where we would want our federal bodies to be engaged and to be a part of this, so that we can surveil and try to make sure that we stay safe here. But we have to watch it very closely because there's already over 600 cases. At least suspected cases, and that number will grow because it is pretty transmissible.
Okay, all right.
So the concern is, what does watching it very carefully mean anymore? Because there was a time not too long ago where the United States would have immediately gone into overdrive with surveillance and containment. Those parts of the U.S. Department of Public Health and its ancillary entities have actually been disengaged. So the United States is noticeably absent from the world's response in this particular example. And this is of importance because it is, in terms of whether Americans should be concerned about this or not, as these feeder diseases pop up across the world, they run the risk of getting on planes, trains, and automobiles and coming to the United States. And one of the defenses that we've always had is being at the front door to make sure that we're that line of defense. So it's a warning. It's kind of like canary in the coal mine. You might want to be careful because as these things, and measles was another example, as these things continue to pop up, eventually something's going to get through. So we can take heed here to really look at whether or not our defenses are what they need to be.
Okay, and switching topics now, something that impacts everyone regardless of where we are is mental health.
Yes.
May is Mental Health Awareness Month,
Yes.
and so many organizations are really diligently striving to put away that stigma associated with getting help for mental health awareness. What's your advice to folks in terms of recognizing this month and really taking care of people's mental wellness?
Yeah, I think we have to just really evolve to the point where we realize that mental health and physical health are intimately connected, and we have to take care of both intensely, intentionally, aggressively, and so really not trying to feel that it's a sign of weakness to get help. It's like if you need help, then it's actually a strong move to go get it, because it affects everything that we do. It affects your physical health. And so we really want to have all of the opportunities. We are very proud at Sinai to be able to provide that access, because it's not equal access to mental health resources. And so we're excited to have it for both children and teenagers and adults, and whether it's for substance abuse or we need inpatient or outpatient therapy, family therapy, group therapy. We're really proud to be able to make that available to our community.
And I think that's a good transition to talk about this recent national debate when it comes to the psychiatric drugs. It's intensified following significant policy shift changes. What do you all have to say about that? And what's the truth that people should keep in mind and know?
Well, this is just an application of what she just said. People need to be aware that sound mind equals sound body. Mental health is health. And understanding that we need to protect ourselves is the order of the day. Now, when it comes to these medications, I'm an emergency physician by training, so I tell people reasonable fears are okay. Reasonable concerns are okay. Unfounded fears are not. And what you're expressing here is an over concern with to be considered side effects. But don't do that to the detriment of the actual diseases that people are suffering with. People are depressed. People commit suicide as a result of these things. And to heavy-handed, we talk about governments and nanny states and such things. It's a relationship between a physician and a patient to determine for each individual whether or not medications are appropriate. It's not as if physicians are willy-nilly sprinkling these medications through the air conditioning units. So I'm a little concerned that something would be done to interrupt the relationship between patients who really have severe concerns from a policy level to put guidelines in place. And final point, there's nobody out there in the physician community that's going to say that we don't welcome diligence. We don't welcome review of the evidence. We don't review appropriate applications of these things. But if the message enhances the stigma that exists around mental health, to say that you shouldn't have these medicines or it's wrong, you should feel bad if you do, that's the wrong message to be putting out there. And I hope that the government changes the way in which it's packaging the things that it's trying to accomplish.
All right, well, doctors, we are out of time, but so much to talk about. Thank you all so much for your insights and your wisdom. We appreciate you being here this morning. You can find details on the services and programs offered through Sinai Chicago at sinaichicago.org. And you can find and learn more about Dr. Sterling at jeffreysterlingmd.com.